Moladotunike.
We can
And
hear you.
the course, okay, thank you. And the course title is Objective Structured Clinical Examination. The course code is NSC 210. We will not be having the usual OSKE that we used to have, but this time around, our OSKE will be question-based, in which we'll be assessing our clinical competencies through questions and answer. So please try and get accustomed with that, because we've been doing it before, though we'll have the demonstration side as well as the question side. But this time around, it will be basically questions alone. So by the way of introduction now, the objective structured clinical examination, that is OSKE, is a multidimensional practical examination of clinical skills. It is a tool for assessing clinical competence. So what OSKE does is it will assess your clinical competence. As we all know that majority of our students in nursing, they are in clinical side practicing. So this OSKE is meant to assess your clinical skill and competence. So what are the points to note? I have said it earlier on. The first one is that the OSKE exam, among all others, will be done online. It will be done online. The second one is that this OSKE exam this semester will only assess your critical thinking skills and your cognitive skills via MCQs. So your clinical thinking skills and your cognitive skills will be assessed. Your psychomotor skills will not be assessed this time around. It will only be assessed through MCQs alone, in which there won't be demonstration, but your knowledge of what to do will be assessed. So let's quickly look at the procedures that you might possibly find in your questions. The first one is administration of enema. The second one is position used in nursing. The third one is checking of vital signs. The fourth one, urine testing, insertion of nasogastric tube, hair irrigation, throat swab, normal laboratory values, and general and current affairs. So let's quickly look at administration of enema. For this procedure, you need to understand the procedure, how it is being done. I know we are familiar with it. There is no, I don't want to believe there is any of us that does not know what to do when it comes with administration of enema, especially when we have a pre-operative patient that are going in for surgery, and you may have to administer enema to them. Then also you have to know solution used in administration of enema. You have to know the solution and also indications for administering enema. What are the indications for administering enemas and the contraindications too? So your questions will be around the highlighted options, the highlighted, the listed options here. So the question will be around this. Please kindly master the contraindication, the indication for enema. Also, position used in nursing. You have to know various types of positions used in nursing, such as supine, prone, high fowler, semi-fowler position. We have a lot of them, lithotomy, orthopnic position, different positions that are used in nursing. You have to get conversant with them. Then indication for each of the position. You don't just put a patient in cardiac position without a reason for it. So you have to know the indication for each of the position. Then the contraindication for some of the positions. You can't put a patient that is having maybe a spinal cord injury in a cardiac position. That's one of the contraindications. So you can find questions around that area that will only test your critical thinking skills, how well you can manage. It's not something that will be so hard. So that's that for positions in nursing. So moving on, I want to quickly look at checking of vital signs. What are the things you need to know in checking of vital signs? You have to know the components of vital signs, which are the temperature, pulse, respiration, and the blood pressure. The definition of each of the components, for example, like a pulse, now you say is a wave of elongation and distension. So you have to know the definition of each of the components. Then instruments used in vital signs procedures too. Then areas for checking each of the components that I have mentioned above. Areas that you use, whether for temperature, it could be axillary, rectal, oral, and the indication for using those areas. You please try as much as possible to master them. Then likewise, for like insertion of for taking of the body temperature now. For infant, if you are taking a rectal temperature of an infant, what is the length of the thermometer? What length of the thermometer will you insert into the infant? Is it 2.5 and the rest? For infant is for a child is just 2.5 centimeters. So those are the things you need to master. Then the procedure proper. You can have questions around that too. The normal value of each of the vital signs is important for you to know the normal values of each of the vital signs, the average value. Like for pulse now, some will pick 72 beats per minute as the average value. So those are the things you need to know. So there are things that you have been doing on the ward. We just want to assess your knowledge of them. So also we are going to be looking at urine testing. You have to understand the procedure. Then the reagent used in urine testing, the reagent you use for blood glucose, the reagent you use for protein, and others. So you have to be familiar with the reagents used, whether it's Benedict solution and the rest. Then the color each will give you, whether it will plum brick red. So please try as much as possible to master all these areas. Then abnormalities that should be observed too. You need to know the abnormalities that you observe in urine. And also, even before taking your urine sample, even before testing your urine, there are some things you need to know. The deposit, you check the deposit, you check for odor, you check for color. All these areas are so important in this forthcoming exam. So try as much as possible to master them. For moving on, I will quickly look at insertion of nasogastric tube. You need to understand the procedure. How do you insert it? What length will enter? What length of the tube will you pass into your patient? Then the materials used for the procedure too, the indication and contraindications of the procedure. For contraindication, you can't pass a nasogastric tube for a patient with esophageal tumor. There's no way you want to pass it. So those are the things, your knowledge of those are the things you need to know too. So moving on, I will quickly look at ear irrigation. Under ear irrigation, the procedure ear irrigation you need to understand, then how it is being done, then the materials used for the procedure, you need to know that likewise. Please kindly read up on all that. Then indication for ear irrigation too, you need to know that. And also the contraindications for ear irrigation. Also, furthermore, we'll look at throat swab. Throat swab, you know the current situation in the country. In fact, a number of our nurses are already taking it. So you need to understand the procedure because it's part of nursing procedure too. You need to know the materials used for the procedure, the indication, and the contraindications of the procedure. One of the contraindications, one of the nursing responsibility while taking throat swab, maybe I should just chip this in, is that it must not touch, when you're removing the swab, when removing the sterile swab that you are using to take this, the sample from your patient, it must not touch the roof of the mouth or the tongue because it will alter the result. So those are the things you need to know too. So moving on now, we'll quickly look at normal laboratory values. The normal laboratory values. You should have some normal values at your fingertips, such as the PCV. If nurses are asked the normal hematocrit value of hematocrit value of a female patient, you should know the range, maybe between 38 to 50 something. It's a range to 48 rather, and for the male patient too, 48 to 50 something, maybe 52 or 53. So you should get familiar with those things because we come by them every day as we nurse our patients, and it's important for us to know the normal value so that when the abnormal comes in, we will quickly identify them. Then you also know, try as much as possible to know the erythrocyte segmentation rate, serum bilirubin level, the electrolyte values, sodium, calcium level, and blood urea and nitrogen level too. Try as much as possible to get familiar with that. And lastly, this afternoon, your general and current affairs is also important. We would like to test your knowledge on current affairs, especially on health matters. Especially on health matters like the minister for health. Those things are important for us to know. So especially on health matters, we'll be limiting it to we'll be limiting it to health matters alone. So please get to Nigeria alone. Thank you for your patience and thank you for listening. I wish you all the best in your examination. So I welcome questions and contributions from you. Thank you.
Thank you, our able facilitator. So we now entertain question. So not much question, just like from 3 people. I think the presentation is okay. So, and you are not new to the clinical environment, and you have been told that the mode of exam will not be the clinical one, but it will only be through the MCQ. So now, Olufemi Oyedepo, your question.
Go
ahead. Can you please off one of the device?
Good afternoon, sir.
I'm sorry,
Good afternoon,
you are not allowed to talk again. You can't off one of the device.
Good afternoon, sir, and good afternoon, ma. Thank you for the presentation. Since the OSKE, we generate many questions. Are we expecting that it will be typing the answers with the keyboard?
Hope you know the difference between the MCQ and filling the gap, or true or false?
Yes. Yes.
What is the meaning of MCQ?
Multiple choice questions.
Okay. Are you typing when you are picking an options?
No.
That will answer your question.
Okay.
Ambrose.
Yes.
Ambrose. Can you speak louder? Thank you.
Hand first.
Chinedu, your question, please.
Good afternoon, sir.
Afternoon, Chinedu.
Okay, so I want to ask, when she was talking about investigations and their various ranges, like some institutions have various and differences in their ranges, depending on the organization or the hospital. So, because my facility might be using, or in the net, it varies. So how can one get the accurate, maybe she will set a question, say between this to this, and the thing did not fall from what you know. So how will you choose?
Thank you for that question. The answer will be on the average, the range, and definitely there is no way you will want to. Every policy or the institution, they will definitely fall within a range. So, like I cited an example the other time, that if you are asked to tell us the PCV of a female patient, adult female patient, you can't go and choose between 55 and 60 or 50 and 60. If you see that in your option, definitely you know it will move between the range of 37 and 40 something. So every institution, everyone, they will fall within that same range because they are using the same textbook. So just the average is what we are looking at. So if you think your institution is picking 42 as the PCV, then you have that range, maybe from 38 to 45. Then you'll be able to know the right answer and pick the average. So we have put that into consideration while setting the question too. But for you to know the range, which you can find anywhere in the world, that when you get anywhere to anywhere in the world, you have the range of that PCV or whatsoever level of laboratory values that you are looking for. They definitely have a range. So you have the range in your exam. Thank you.
Okay. Thank you. Chidima, unmute yourself. Okay, I think I'm not sure if you can take any other question because try to unmute you, but it's like majority of you are not connecting your audio properly, so I'm unable to unmute you. Okay, Deborah.
Good afternoon, sir.
Afternoon.
Good afternoon, ma, for that wonderful presentation. I can see that you just run around the clock. But ma, most of us, we are not in the clinical area. And all those things you are saying that have ranges, that's been long that we've done it. So, ma, please, I would like you to throw more light on this issue of this urine, those hematocrates, PCV, and all those, ma, please. No, we don't have the materials with us.
Okay. Now, for the normal
Something paining.
hematocrit for male percent, that's the range. So you can even the range is 42
Sorry,
to 52 because
Facilitator,
that's the
can you
range
please,
of the hematocrit.
Facilitator,
You have the range of 37 to 48. Is within 37. Yes, I'm listening,
Facilitator,
Mr. James.
can you please
Yes, sir.
start the answer to the question again? Your audio was off when you started.
Okay, so I'm here again. So I said the normal range for PCV for male is usually between 42 and 52. So you can have some textbooks or some online recommendations that will give you like 45. Is still within the range. So usually you can pick from 42 to 52. Then for female is usually between 37 and 48. Usually between 37 and 48. So if you go online, you will find the range between for all these. Then for serum bilirubin, if it is direct, is usually 0.4 milligram per 100 mils of blood taken. So you will find 0.4 milligram per 100 mils of blood taken. So all these values, they are on the internet. You will find it there. You find it there. So it's not as if there is more disparity in the values you will see. There could just be a little, but it will fall between the range that is, because female in Nigeria is the same as female all over the world. There could just be a little disparity in the range, in the average value, but the range, whatsoever any journal or any internet is giving you, it will still fall between the range given. So please, all this has been put into consideration. You just need to read up on them because they are important to nursing. Thank you.
Okay.
And it's not just, yeah. Mr. James, you can continue, sir.
Yes, I'm trying to unmute them, but majority of them are just raising their hands without connecting their audio. Adeniyi Oluwabunmi.
Yes, sir. Good afternoon, ma. Thank you for that wonderful presentation, ma. Ma, sorry, I was late. I couldn't log in on time. All I heard when I logged in was that you have finished your presentation. I wouldn't know if you can just please, ma, just a little bit go over what you have said, ma.
I'm so sorry. I'm so sorry, madam. That one cannot possible. So although I will try as much as possible to give you the video on the what they call it on your WhatsApp group so that you can go over the video. But for her to go back to the presentation again, that one is not possible. We don't allow that. Then the video sent to you, we told you to like or subscribe to the YouTube so that you will receive the new notification. The time will come that we may not be able to post every video concerning your lectures online again. But if you have subscribed to that video, you will receive the notification that a new video is available for you. So just wait until I make it available on the YouTube. Thank you.
All right. Thank you very much, sir. Thank you, sir.
Ibrahim.
Yes, sir. Good afternoon, sir.
Good afternoon.
Hello. Good afternoon, sir.
Good
Good
afternoon. You
afternoon.
are welcome.
Yes, the question, sir. The question I want to ask is concerning the this technology-derived exam. It's not pertaining this OSKE of 18 months, sir.
Go ahead.
So, sir, please, can a single system be used by many students during
Yes.
this exam?
For this technology-driven exam, 4 people can
Yes,
use
sir.
a system, 5 people can use a system, 10 people can use a system. But there is condition attached to it, and the condition is this: if the first person, if person A finish his or her exam, ensure you restart that system before person B will start. And once person B also finish his or her exam, restart the system again. That is
Okay,
the
sir.
procedure. Thank you.
Okay.
Then for the last, okay, let's take this one. I'm trying to pick the last person, but okay. Charity, Chidima, or Charity? Your question. Okay, sorry, we have come to the end of today's facilitation on NSC 210 OSKE. So we wish you best in your exam. Follow the rule and regulations, and don't forget to do more on your own area, to do more of research. God bless you. Thank you. Facilitator, thank you.
Thank you, Mr. James, for always being there.